If you are suffering from a chronic condition like fibromyalgia, chronic fatigue syndrome, hypothyroidism, irritable bowel syndrome, or even type 2 diabetes, let me first of all say I understand your frustration. And from my perspective, the modern medical community has failed you. When it comes to emergency medicine, there's no one better than the United States of America. But where long-term chronic disease is concerned, we have absolutely dropped the ball. Let me say I am sorry. I have worked with patients suffering from chronic conditions for over a decade. I've heard your stories, I've seen your pain, and again, I understand your frustration. For many people who suffer with these chronic conditions, the disease goes undiagnosed for years and years. You may feel like a lab rat in some cases, having the latest drugs tested on you. Many feel hopeless, helpless, and afraid. I'm Dr. Mark Dailey. I am a certified functional medicine practitioner with advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, with advanced education in thyroid function. I'm a nutritional counselor and doctor of chiropractic. I've worked with fibromyalgia, hypothyroid, chronic fatigue sufferers for over a decade. Functional medicine is the core of our treatment protocols. Functional medicine does not cover symptoms with a medication, but goes to the source of the condition using a thorough patient history, evaluating past examination and lab tests, using state-of-the-art advanced testing that looks at stool, saliva, blood work, urine, even hair analysis to discover the source of the problem. This allows us to see the patient from different aspects, making it much easier to diagnose the problem and design a specific treatment protocol. When it comes to chronic disease in America, there are a few misconceptions. One of those is that there's a pill or a drug that will alleviate all your problems. This is simply not true, which means your medical doctor is not going to come up with a magic cure. Where chronic disease is concerned, healing is always a process, and you as the patient have got to be deeply involved in that process. In most of my patients, there was a slow breakdown and then the straw that broke the camel's back, which makes it look like the problem happened all of a sudden. This is rarely the case, however. In most cases, the foundation of dysfunction starts with lifestyle issues. The standard American diet and the stress that we put on ourselves starts a cascade of physiological or body system dysfunction that leads to your current condition, or that led to your current condition. There's normally a breakdown of multiple systems in your body which overlap and make diagnosis confusing and difficult. This creates a tremendous amount of stress, both physiologically and emotionally. This stress over time leads to disease. Let me encourage you though, because there is hope and there is help. Let me also say that I believe you have a purpose in life, a destiny, if you will. Unfortunately, many of us will never fulfill our purpose or reach our destiny because we're sick and tired, can't think straight, and unfortunately many die prematurely. Please don't let that be you. You need to regroup, you need to stand up, you need to fight to regain your health. Now, I've put together several case studies that show the difference between functional medicine and modern medicine's approach to several common chronic conditions. If you'd like to receive those case studies, I'll be happy to send them to you. They're in video form and they're extremely enlightening. Simply give me your first name and your email address. We'll shoot those over to you. And I want to thank you though for your time and your attention. God bless you. Have a great day.